some facts. 1.7 billion people. The moment I say this, what it denotes? Any clues? Is it a number of people eating boneless chicken? No, make a guess based on these facts. According to the World Health Organization, close to 441 million people in high-income countries are suffering from this. Close to 427 million people in Western Pacific region, including Singapore and Malaysia, are impacted by this. 369 million people in Southeast Asia are affected by this. 23.7% of Singaporean adults between the age of 18 and 50 are reported to be suffering from this. In case you have not guessed it, we are talking about skeletal and orthopedic problems. To succeed in life, you need three things: a wishbone, a backbone, and a funny bone. A wishbone is our desire, a backbone chase to desire, a funny bone, so laughter. Hence, bone play a key role for our success. The world has various days: World Spine Day, World Osteoporosis Day, and Wishbone Day. But today is the day to unravel our challenges and how to safeguard, prevent, and secure for orthopedic conditions, orthopedic foot and ankle problems in the young and elderly. A very good evening, ladies and gentlemen. On behalf of GOPIO Singapore, I extend a warm welcome to you to the walkthrough stages, a medical talk session conducted by GOPIO Singapore. We aim to have a better insight on orthopedic challenges. I am Muthukumar Rajendran, MC for today. Global Organization of People of Indian Origin, or GOPIO, is an international organization formed to provide a stable platform to support the needs and interests of the global Indian diaspora. Formed in 1989, a GOPIO now functions in over 40 countries worldwide. GOPIO is accredited by the United Nations as a non-government organization and is recognized as a secular, non-religious, or non-political global organization. GOPIO Singapore, the Singapore chapter of GOPIO, was inaugurated in the year 2002 with a mission to promote the cultural heritage and legacy of Indians in Singapore. Towards this mission, GOPIO Singapore conducts various events. We are thrilled to witness such enthusiastic participants deepen the understanding of the significant topic. To begin with, may I invite the first Vice President of GOPIO, Mr. Chandramohan Maruthan, to the stage to deliver his welcome address. Mr. Chandramohan Maruthan, please, the stage is yours.
Thank you, Muthukumar. Thank you. I hope all of you can hear me. Right. Good afternoon, Dr. Anandakumar. Ladies and gentlemen, a warm welcome to GOPIO Singapore, second medical talk of the year. For those joining us for the first time at our quarterly medical talk, let me provide a brief introduction to GOPIO Singapore in addition to what Muthukumar had earlier shared. Accredited to the United Nations as a non-governmental organization, GOPIO is recognized as a secular, non-religious, and non-political global organization. GOPIO Singapore was inaugurated in 2022, as mentioned earlier, and has been a registered society under the Register of Societies since 2001. Our mission at GOPIO Singapore is to bring people of Indian origin in Singapore and around the world together to promote their professional, cultural, and social interests. We aim to help them realize their maximum potential in the service of global peace, prosperity, happiness, and compassion. Importantly, we provide a platform for networking and sharing up-to-date information that concerns the communities. GOPIO Singapore has over 200 members and plays an important role in Singapore by bringing together various Indian organizations and communities. Besides hosting our own events, we also collaborate with key organizations such as the Indian High Commissioner of India to Singapore, SIKI, HEB, and SINDA to jointly organize events. Here are some of the key events we have hosted. Hosting Indian ministerial visits, like for example, we hosted PM Narendra Modi, Mr. Muralidharan, Sushma Shivaraj, Venkat Naidu, Chandrababu Naidu, and many others. Business seminars we organize locally as well as internationally for business members. Cultural activities, quarterly business and medical talks, youth activities and camps in Singapore as well as Malaysia, and GOPIO
Use my PC to join us, Geeta.
GOPIO Junior Star, and sorry, someone's saying something. Sorry, GOPIO Junior Star and our Gandhi Jayanti celebrations or United International UN Day of Non-Violence. For today's event, our focus is on the community's well-being. We have invited Dr. Anandakumar to discuss foot and ankle health. Orthopedic care for the foot and ankle focuses on treating injuries and conditions that affect these important parts of the body. This care helps people walk and move without pain. We are excited to hear from Dr. Anandakumar, a skilled orthopedic surgeon who specializes in foot and ankle treatments. Dr. Anandakumar will share his knowledge and the latest advancement in helping patients recover and stay active. I hope many of you attending today's talk will benefit from the insights shared by Dr. Anandakumar. At this juncture, I would like to extend my sincere thanks to Dr. Anandakumar for taking the time to give us this valuable talk, and to all of you spending your Sunday evening with us. Without further delay, I would like to hand you back to our MC, Mr. Muthukumar, to introduce the speaker in more detail. Back to you, Muthu.
Yeah, thank you, Mr. Chandra. Thank you for such a gracious welcome address. Let's go to the next segment. Our body is a remarkable instrument that has the power to heal itself and perform amazing feats, but it needs our care and attention to do so. Let us hear from our presenter on how to care, prevent, and cure. It is now my pleasure to introduce a medical talk speaker, doctor, for today's session, Dr. Anandakumar Vellasamy. Anandakumar Vellasamy, coach, board accredited orthopedic specialist surgeon with the OrthoCare, Orthopaedics, and Sports Medicine. With over 20 years of experience as a former consultant from the Singapore General Hospitals and Sengkang General Hospital, Dr. Ananda's practice consists of treatment of general orthopedic bone, joint conditions all across the body affecting the young and elderly, knee, foot, and ankle, as well as the types of sports injuries and fractures too. As a leading foot and ankle surgeon too, he remains at the forefront of medical advances, having performed the first lateral total ankle replacement surgery in Southeast Asia for ankle arthritis. By the way of background, Dr. Anand graduated with the MBBS from National University of Singapore in 2003. He was awarded the Best Houseman Award during his medical posting as a houseman. He subsequently pursued his postgraduate training in orthopedic surgery in Singapore and obtained his fellowship from the Royal Challenge of Surgeons in Edinburgh. He was awarded the N. Balachandran Memorial Lectureship Award in the final year of his orthopedic residency in 2014. He was subsequently also awarded the prestigious AO Trauma Fellowship Award in 2015. He was awarded the Health Manpower Development Plan Award in 2016 for the way forward in delivering world-class care in foot and ankle surgery, which enabled him to pursue his fellowship training in Switzerland under world-renowned foot and ankle. Dr. Ananda also further honed his skills by training with Dr. Alexandro Pellegrino at the Center of Minimally Invasive Surgery at the Zell Clinic in Zurich. As a recognized surgeon, Dr. Ananda is one of the few surgeons accepted as a member of AO Foundations, American Association of Orthopedic Surgeons, European Foot and Ankle Society, American Orthopedic Foot and Ankle Society, the Singapore Orthopaedic Association, and the Orthopedic Foot and Ankle Society of Singapore. Dr. Ananda also has presented and instructed at numerous orthopedic surgery meetings, both local and international, including the American Academy of Orthopedic Surgeons, European Society of Sports Traumatology, Knee Surgery, Orthoscopy, and European Federation of National Association of Orthopedics and Traumatology, and at the Asian Orthopedic Association of meetings. To say this, I'm panting. Look at the way effort he has done. Before we invite the speaker, I'm going to share a link in the chat group for you to log in your questions during presentations. So post the presentation of the doctor, we'll be having a Q&A session where doctor will just respond to your questions. Okay, I'm just sending you the link in the chat box. Hope you all received it. Just click the link, enter your questions while going through the presentation. Towards the end, we'll have a Q&A session for the answers from doctors. Ladies and gentlemen, please join me in welcoming our Dr. Anandakumar Vellasamy for the medical walkout, a walk through the stages to share his expertise in common orthopedic, foot, and ankle problems in the young and elderly. Doctor, the virtual floor is yours for the webinar. Thank you.
Thank you so much for the warm welcome. Thank you. Okay, I'm going to just share my screen now. Can you see my presentation?
Yeah.
All right. Okay. Okay. So, yeah, once again, many thanks for the warm welcome. It is certainly an honor and a pleasure to be addressing GOPIO Singapore and to be delivering this health talk, which is quite close to my heart. I mean, orthopedic surgery is my passion, and today I'm going to try to have a conversation perhaps with the floor on some of these common orthopedic and foot and ankle problems in the young and elderly. I will not just be talking about foot and ankle problems, but I will just generally share also on other orthopedic issues as well, because I do see a general plethora of issues in my clinic, not just on foot and ankle issues. So I do see general orthopedics as well. And I think that it's interesting that, in my talk, I've actually written down common orthopedic and foot and ankle problems in the young and elderly. And I think in this day and age, we need to think about this word elderly with a little bit of sensitivity, because we have elderly patients who are running marathons and doing a lot of activities that even younger patients do these days. So I think gone are the days where, we kind of pigeonhole the elderly as, just capable of doing a few things. But these days, the elderly are very active. And therefore, I also see a whole host of musculoskeletal problems in this group of patients as well, because of the fact that they are more active in this day and age. So, as I mentioned, I do see a common host of orthopedic problems and conditions that affect the entire body. All right, and I think in doing orthopedic surgery, what I've realized is that a large part of the population that I see sometimes have this misconception that, if I'm injured or if I've got some pain in a particular part of my body, maybe I should just rest it and it will get better. I think this can't be further from the truth. I mean, I do agree that rest is part of the healing process, but it is not the entire story. I believe that movement is life, and in addition to resting, some form of physical therapy or physiotherapy is important in rehabilitating injuries of the musculoskeletal system. So that is something that I think is an important concept that I would wish to pass on to the audience who's listening to me today. And also, notwithstanding this, I do believe that diet and supplements in this day and age have become quite important in actually making sure that this bone and joint problems do not get worse, because we tend to be a very vitamin D deficient population these days because of lack of sunlight, or that we are indoors more often than before. So that is something that we may neglect in our diet and in our supplements, that we are not having enough of this nutrition like calcium and vitamin D. So that's something to take note of as well, which I will touch on in my presentation as well. So the next slide. Why do we have bunions? Blame and evolutionary toe failure. I think this is a very interesting article that just came out earlier this month on May the 8th. And I think it goes to show that some of these orthopedic problems that we seem to have may not just be related to injuries or maybe our lifestyle decisions, but there is a certain genetic or inherited factor to these issues. And that's exactly what an evolutionary problem seems to signify. I will go on a bit more about this in my next slide, but essentially, how do we think about evolution and orthopedics? I think if we think about our closest cousins, who are the chimpanzees, for example, we have actually evolved to being human beings essentially from that state. And essentially that is interesting in its aspect, because as human beings, the most defining part of our species is the fact that we walk on our 2 feet. We are bipedal organisms. And there in itself can actually be one of the reasons why we may be having orthopedic problems, because of the very fact that we are bipedal organisms and we are bearing our entire weight on our 2 feet. This can lead to issues, which I will discuss in a while. But before that, I would just like to go through this little video, just so that it's a silent video. So it's just a little snippet of what I'm trying to explain in terms of the differences and the similarities between us and our closest cousins. Okay, so that was a short video that shows how we are similar and how we are very different. And I think that is what bipedalism is that we are actually the only organisms that actually are spending all the time on our two legs. So what exactly happened? How do we become from arboreal creatures to actually human beings? We still don't exactly know, but about 7 million years ago, the waters receded because the temperature rise in the planet caused the waters to actually be less, and there were more lands and plains and savannas that started to appear. And therefore, the need for transmigration to look for food, to escape from predators became something that was necessary for us. And so therefore, there was a survival of the fittest, right? That's basically how evolution takes place. And essentially, it was more selected for us to be on our feet because we could stand taller, we could look out for predators and dangers. But more importantly, the very fact that we could stand on our feet also allowed us to free our hands, because this was important for tool making, fine work, agriculture, and writing, which is basically how we evolved as modern human beings. All right. So we can say that actually without the evolution of the foot to be a structure that allows us to walk, we would still be arboreal creatures that stayed in the trees. So in that aspect, being on both our feet can be our friend and also our enemy, because when our entire body is balanced on our 2 feet, then the alignment matters a lot more, because it's our own 2 feet, only 2 feet, that is actually taking the entire weight of your body and your spine. All right. So this also means that your muscles that is around your joints are also very important in supporting these joints as well. And also when you're on 2 feet, the balance that's important when you're doing your activities to actually maintain you standing on your 2 feet or running on your 2 feet, that's also very, very important to prevent you from falling or having injuries. And in that same grain, the quality of our bones are also very important to prevent our bones from becoming weak or being more easily fractured from any of these injuries. So what happens as we walk through the ages? There are some common problems that occur at different age groups, and I'll just like to talk a bit about this. So when you talk about patients from the age of 1 to 6, oftentimes I have parents of patients who are very concerned about, doctor, my child seems to have a bit of a flat feet. Is there something to be concerned about? Because I've got flat feet and I've got some pain, and I'm afraid that, my child is going to develop this as well. So these are some of the common questions I get in my clinic. And then from the age of 7 to 17, another set of problems happen, because this is the school growing age, and children are usually very involved in activities throughout the week. I mean, they are doing all sorts of sports, different sports on different days. Tuesdays, cricket; Wednesdays, badminton; Thursdays, gymnastics. So it's like full on for them. And I mean, it is very enriching, but it's also an age where your bones and your tendons and your muscles may be growing at different rates. And that's also a cause for concern sometimes when these children come with pain, because these may be part of growing pains, because the bones and the muscles are growing at different rates during this age. So activity certainly exacerbates this pain in this group of patients. And then when you talk about the age of 18 to 35, this is the age where, maybe if you're a local boy, you may be going to NS, and that's also going to be a stress on the musculoskeletal system, because it's going to be from undergraduate, and now you're going into a army where you're going to be doing activities all day long. You're going to be doing all sorts of military operations, and that can be a stress on the joints, and it can cause injuries as well. And it's also in this age that it's important for patients to actually understand that, as much as, you may be busy in university, studying hard, you may also be concentrating on your career. Do not forget that, your joints are actually at this moment in time, your bones are actually the most, they are actually trying to get healthy, and you actually are going to be building your bone mass during this very important age, up to the age of 35, where you actually reach your peak bone mass. So it is important to take note of your nutrition and exercise, because if you do not actually address this at this age, it may lead to problems in the future as well. And in the age of 35 to 50, that's where the problems start happening, because maybe at 18 to 35, it was not taken care of to a certain degree, or there were injuries at that age, and the injuries start to surface at 35 to 50. And even maybe sometimes too much of exercise, or maybe even the lack of it, may actually, or maybe not knowing how to do exercise safely, can actually lead to injuries at this age. So strength and conditioning may be something that patients at this age group may want to focus on, essentially. And then we talk about 50 to 80. And in this age group, we talk about patients who are actually having degenerative or wear and tear issues of the joints and the bones. And therefore, they may be having like poor bone quality, osteoporosis, osteoarthritis, which is basically wear and tear of the joints, and they may have chronic pain happening at this age, right? So let's talk about a very common foot and ankle problem that I see in my clinic: flat feet. Okay, what is flat feet? Essentially, as the name suggests, when there's no gap between the floor and the feet when you're standing, this is what is called flat feet. Now, generally, when you stand on the floor, your feet has got 3 points that is touching the ground. It's A, B, C, as you can see on the diagram there, which is basically your big toe, your little toe, and the heel. And as you can see, these 3 points actually create an arch of your foot. As you can see in the picture on the right, you can see there's a nice arch that ABC forms. And also ABC also gives you a 3-point contact like a tripod. And as you know, a tripod, the reason why we use a tripod is because a tripod gives you stability. And so the presence of an arch actually has a very important function in giving stability to the foot. And that's why you notice when patients who actually have flat feet, they tend to have a higher chance of injuries, ankle sprain, like ankle sprains, or injuries of the foot and ankle. Or the
butter, I love it.
All right. Okay, sorry about that. I think someone has not muted. Okay, all right. Yeah. Anyway, as I was talking about having an arch, the presence of an arch actually helps to prevent injuries. And genetically, when you talk about children who come with flat feet in my clinic, as long as you're below the age of 6, I would usually tell patients or parents who are very worried that it's normal to have a bit of flat feet below the age of 6, because your arches are still developing below the age of 6 years old. All right. However, if your flat feet continues, or your arch becomes low or is flat beyond the age of 6 years old, that's when usually I would be a little bit more concerned, and I will tell parents, especially if there's 1 or 2 of them in the family who may already have flat feet, that maybe it's better for you to consider maybe an arch support in the shoes of your children, so that we can actually help to prevent the flat feet from getting worse as the age goes on. All right. Now, the other thing about flat feet that you can see is that flat feet can sometimes be associated with other conditions. And that is why we are also sometimes, we will need to check if a child or an adult who has flat feet with an X-ray or even an MRI scan sometimes, to see if these other conditions are present. One of the common conditions is something called an accessory navicular bone, which is a bone, as you can see on the bottom picture, that is on the side of the inside of the foot. And this extra bone can sometimes cause a lot of friction around that area, causing pain for the patient. And it's something that we will need to check. I mean, of course, the treatment for flat feet, generally speaking, can be conservative in 80 to 90% of patients, with good arch supports, some footwear modifications, physical or physiotherapy focusing on stretching the calf muscles, strengthening some of the tendons. And this is important in preventing problems related to the flat feet. Now, some of these are some pictures you can see, like the picture on the right hand side. You can see that there's this optimal arch insole support for the patient that helps to give you a little of an artificial arch. But an artificial arch is also important, because this artificial arch that the insole is providing helps to support the tendon. As you can see on the bottom left-hand picture, there's actually this tendon called the posterior tibial tendon. And this tendon is very, very important in helping you form an arch. Now, usually patients who have flat feet, the tendon is very weak, and that's why they develop this flat feet. So supporting this tendon will help to relieve the pain that they feel in this area sometimes. As you can see, the picture on the left hand side shows a New Balance shoe. But what is very interesting about the shoe is that you can see the shoe has got it's shaped like a rocking chair, because it's like curved upwards in the front and it's curved upwards at the back as well, just like this rocking horse that you see on the side. And this is very important because it helps to modify the way the patients walk when they wear shoes like this. When they wear shoes like this, the shoe helps them propel themselves without using a lot of their muscle strength. And that is important in preventing the pain in the muscle or the tendon that patients with flat foot will have. Just like how if you take a rocking horse and you just shift the horse, it will tend to rock for a while before it stops. Why does it do that? Because when you rock a horse like this, it's actually it's actually saving energy. And so shoes like this help to save energy and helps to prevent the muscles from becoming more stressed. Now, if you look at the person on the right doing a calf stretch, I've demonstrated this in this slide because what I've usually noticed in patients who have very flat feet is that they have very tight calf muscles as well. And tight calf muscles can actually be a common problem that can cause the flat feet to become worse over time. So I would always encourage them to actually do a lot of calf stretching exercises that will help. Now, what is the other issue about having flat feet? As I mentioned previously in my slide on us being organisms that actually stand on 2 feet, what is very important is the alignment of the skeletal structure. As you know, your foot supports your knee, your hip, and actually your spine. And so if your ankle, your knee, and your hip are in a straight line, it means that these joints, the ankle, the knee, and the hip, are working as partners to take the weight of your body. All right. However, if there's a misalignment of your feet because of flat feet or injury, for example, then the ankle, the knee, and the hip may not be in a straight line anymore. And when it's not in a straight line anymore, these individual joints are working separately by itself to actually support the weight. So there's a lot of more stress in the individual joint because of this misalignment. So what is akin to it is like a Jenga game block, as you can see. All right. So when we play Jenga and all the blocks are nicely aligned, it's a very stable structure. And that's like how a normally aligned feet is. However, if the feet is misaligned, like you have a flat feet or very bad flat feet and there's misalignment of the joint, then it's something so much so like a Jenga block with a lot of blocks removed, and it becomes very unstable. And there is actually, what that does is that it actually stresses the muscles around the joints, and the muscles can become very painful. But after a while, when the muscles get tired, then the joints become more stressed as well. And that is the reason why arthritis happens. And this is not just limited to the ankle. It also can happen in the knee, it can also happen in the hip, and it can also happen in the spine. So these are some general principles in orthopedic surgery that I would think that it would be useful for patients to understand, that essentially we're talking about alignment, we're talking about making sure the alignment is good, how you can wear shoes to actually improve this alignment as well, so that you prevent the joints from becoming stressed. So some of the take-home points that I have for flat feet. Generally, in children above 6 years old with flat feet, it's good to start them on insoles because that will help to prevent the flat feet from getting worse. It will help to improve the alignment, and especially in this age where they are developing their muscles over the next 5 to 10 years, as they're developing their muscles, having an insole will allow the muscles to develop properly, okay, as they are growing up, and this can hold them in very good state as they grow older and in adulthood. Okay, and I would say that pain in patients who have flat foot, if it's present from the age of 10 onwards, should be investigated. So seeing an orthopedic professional, doing an X-ray or an MRI scan may be things that may be necessary for patients with flat foot with pain from the age of 10 onwards. Okay, and I would say that using good sports shoes like I showed previously, which are basically called rocker bottom sports shoes, are actually beneficial in helping save energy, preventing pain. Calf stretching and using insoles are also very good advice that I will give patients with flat feet. Physiotherapy to improve the strength and also to stretch the calf will be useful in both children and adults if their flat feet is quite severe. and they have pain. Okay, the next condition I want to talk about is heel pain, which is a very common condition I see in my clinic quite often. And oftentimes the pain is described to be at the bottom of the heel, and it's actually worse in the first step they take in the morning. And usually it gets better as they take more steps. And sometimes if the condition is very bad, it gets worse, or because it's just very severe, the heel pain. Now, why is it that this is a problem? This is a problem because oftentimes we get these issues with patients with very low arch or flat feet and with very tight calf muscles. Now, the reason why tight calf muscles cause pain in the heel is because when you have a tight calf muscle, all the stress of walking falls on your heel. And therefore, there's a lot more stress on the heel, and the plantar fascia, which is basically this very thick ligament on the bottom of the heel, gets strained near the heel bone. All right. So what helps? As a first line, if you have a lot of pain, you can always wear some heel cushions that you can get in the pharmacy. All right. Now, I would say that physiotherapy is usually very effective in 70 to 80% of patients with heel pain problems, where we focus on stretching your calf muscles on a very regular basis, or teaching you how to stretch your calf muscles on a regular basis. Sometimes the physiotherapy can also administer something called shockwave therapy on your heel bone or your heel tissue that is actually will help to reduce the inflammation and the pain. Now, sometimes whenever patients have tried all this and it doesn't seem to help, then of course the last resort is usually some form of minimally invasive surgical procedure that can be done for patients who do not respond. Now, I do not encourage injections, although this may be something that some patients might actually say, oh, this doctor encouraged me to have this steroid injection for my plantar fasciitis or my heel pain problem. I would say that it may be necessary, maybe if you feel a lot of pain, but I wouldn't encourage taking at least more than one injection. I think one injection is the most I would go, because whenever you give a steroid injection in this area, what it does is that it actually softens the structure. So the bad side of it is that over time, if you take a lot of injections, your plantar fascia will be very, very soft, and it can actually rupture very easily, and that can cause more problems. So I would certainly not encourage this as a regular therapy for patients who have this problem. Okay, I'm going to go through a case study now. Okay, a case study on a patient who came with bunions. So you can see this is a 55-year-old lady. She basically complained of this painful bump on the inside of her big toe. As you can see, that's an X-ray, but you can see that there's a bump, a very obvious bump on the inside of the toe. And usually when patients have this bump, they complain of pain on wearing shoes, because the shoes are always rubbing on this bump. It can cause a lot of swelling on the outside of the skin, and this can cause a lot of issues. They can't find good shoes to wear because usually their foot is very wide, and finding proper shoes may be a difficulty as well. Now she has had it for years, and she has been using spacers in between her toes as seen on the below picture. However, it has not helped her, and the pain has gotten worse. So she actually was quite keen for a surgical solution, and we actually did a minimally invasive surgery for her. As you can see, the bunion has been quite well corrected. The alignment is now quite normal, and you can see that actually the surgery is so minimally invasive that we can't even see the scars, because that's the technology that we have these days to actually perform these surgeries in a very percutaneous, or very small incisions that heal very well. And this is how we do the surgery. Generally speaking, we use a special burr pencil that can actually cut bone essentially through a very small incision. And we do this under X-ray guidance, and it helps us reduce the post-operative pain for the patient, which is very important. And because of the very fact that they are less pain, they can actually walk immediately after the surgery. All right, it can be done as a day surgical procedure, and because of the fact that we have actually made such a small incision, or a little bit of small incisions on the foot, they have less risk of their bunion coming back again as well. All right, so what is it about bunions, flat feet, and heel pain that are common or that is related? Because oftentimes we actually see patients with all of these three conditions happening at the same time. Now, the reason is because usually patients with bunions, flat feet, and heel pain, they have a certain amount of laxity in the ligaments. That means when they are genetically, they tend to have a bit more, their ligaments are a little bit more susceptible to stretching. And that's why, their foot is flat, because the structures are so, they are not strong, and they are so flexible that they actually become like a flat foot on the ground itself, because everything is stretched out. They are not strong. And similarly, so the bunion also becomes worse over time because it's being stretched in the wrong position. And because of these two issues, they tend to also then develop a lot of issues with a tight calf muscle that I mentioned was something that tends to happen with patients with bunions and flat feet. And then they develop heel pain from that as well. So oftentimes what we notice is that these problems happen together. And because of these issues, they also develop an alignment issue, and therefore they develop pain, and they may also develop knee pain, hip pains, and even back pain. So patients with flat feet, not very uncommonly, they also have knee pain and they have back pain as well, because the whole issue is because their muscles are more flexible than strong, essentially. So that is where I usually will advise them that, if you have issues like this, you have to concentrate more on a strengthening program. That means the physiotherapy should concentrate on strengthening your knee, strengthening your gluteal muscles, strengthening your back and your core muscles. This is very important because it will help to prevent the problem from getting worse over the future. All right. So I'm going to go through case study 2. All right. So there's a 58-year-old man with ankle pain for years, and he can't walk, and it was very painful for him. And you can see on the X-ray on the right-hand side, there is already, the bone is touching the bone. Essentially, there is no space between his two bones where it's supposed to be a joint. When it's a joint, you're supposed to have some space in between the joint. But you can see that there's no space. The bone is just touching the bone. And he couldn't walk. He was in pain. He was very stiff. So he had tried traditional Chinese medicine, painkillers, and treatments that didn't seem to work. So he was very keen for a surgical solution, and I offered him a lateral ankle replacement. And that's what we did. As you can see on the picture there, we have a lateral ankle replacement. This is the first lateral ankle replacement that was done in Southeast Asia. And it was reported in the news as well. And it's a very advantageous procedure because the replacement is done from the side of the ankle. And that allows you to see the whole profile of the ankle joint. Because of the fact that you can see the whole profile of the ankle joint, as the surgeon doing the procedure, you can actually reduce the amount of bone that you are actually cutting to actually put the implant inside. All right. And that also allows you less risk to the important vessels and nerves. So it is a very advantageous procedure. And after it was done in Singapore, a lot of people around the region and have started doing this procedure as a very common and go-to procedure for patients with ankle arthritis. Okay, next I'm going to go through another study, very common problem that we see in the community all the while. I mean, it's a very common thing that I see in my clinic all the time, patients with knee pain. All right, so knee pain, we know at the age of 60 years old, you can't walk, it's affecting your quality of life. And if you look at this patient who came to see me, she had pain on both her knees. She was seen by a different surgeon previously, and the surgeon had offered her injections, but she was having a lot of pain and she wanted a surgical solution when she came to see me. All right, so and her function was deteriorating and she wanted to be able to travel and to walk without pain. So I wanted to show you what a normal knee looks like, and that's how a normal knee looks like on the right hand side. And you can see how different her knees are. The entire inside of the knee is completely worn out, the bone is touching the bone, and she had a lot of pain and there was a deformity in her knees. So I offered her a surgery, and what the surgery that I offered her was a robotic surgery. It's called a Marcoplasty. Okay, Marcoplasty is basically the future, or rather it is already here. It is basically how we do knee replacement these days. Okay, so of course we can always do it traditionally, but there are some good advantages a robot offers us, and that's what Marcoplasty is. A Marcoplasty is basically a device or a machine, basically with a robotic arm. All right, and how we do this procedure generally is that first, before we do the procedure for the patient, we take a CT scan of the patient's knee. And with the CT scan, we are able to determine what are the areas of disease that is affecting the patient. All right. And once we have identified the areas of disease, we can actually do a plan of surgery even before we actually do the surgery on the patient, all right, where we can actually find out what is the amount of bones that we need to remove from the patient before we can replace it, what is the alignment that we're going to correct, what is the size of the implants that we need to use. And also the surgery is also very much safer because the robot is able to sense where the danger points are, where the blood vessels, the nerves may be, and actually help to prevent us from actually endangering these structures, these very important structures. And because of the advancement nowadays, the patients are able to walk much sooner, and they have a very good range of motion of the knees after the surgery, which improves their function as well after the surgery. All right. So you can see this is what we did for her, and she had a successful surgery on both her knees at the same time because she was having pain on both her knees. And I just want to show you a video of her walking just 5 days after the surgery from a patient who was in a wheelchair. All right. So this patient was on a wheelchair, and now it's 5 days after the operation, and she's actually walking on a walking frame. And this is at 5 days. At 2 weeks, usually patients will have just occasional usage of the aids, and at 4 weeks, they don't need any aids at all. That's the advancement that the surgery has made over these years. All right. Now, I get a lot of patients coming to see me in my clinic who have knee arthritis, and they tell me, I had a friend who had a surgery done and the person can't walk now. Is this surgery okay? Now, I think that we need to be very careful when we think or compare patients, because it may not be the same surgery that the person has gone through. So it may just be a knee surgery, or it may be a knee surgery for a very different condition, all right, that may need the person to rest even more compared to a knee replacement surgery. So I believe that these comparisons need to be taken with a pinch of salt. Generally, knee replacement is actually a lifestyle operation. Basically, it is an operation that's done to give you mobility so that you can enjoy a better quality of life. So the most important thing is that the patient will need to basically accept that this surgery will actually help you get a better quality of life than what you're having right now. And that's when you actually choose this surgery. All right. Now, you can talk to your doctor on other options available. There is also the physiotherapy option. There are medications, injections into the knee joint, all right, and a knee guard, which is basically some form of support for the knee joint as well. However, these measures need to be taken with how bad or how severe the stage of arthritis is, because if it's in an early stage of arthritis, certainly physio medications may be more useful or more successful in patients. But if it is a very late stage of arthritis, then unfortunately these measures may not be so successful, or it may be very temporary in this group of patients. Next, we go on to back pain. All right. So the back, as I mentioned previously, can also be a very common problem that I see in the clinic as well. And most of the time, back pain problems, they tend to take a very age group related kind of a way of happening. So when you see a very young patient, maybe in their mid-20s to their mid-30s, for example, a lot of them, when they come in, they have probably been doing some heavy activity, and then they start having a lot of back pain after the activity, or very immediately. And a lot of times this is very much related to posture. Like, what's their posture when they are carrying something heavy? What is their posture when they are sitting in the office doing their work? So posture is such an important aspect when it comes to back problems. As I mentioned previously, as organisms who are on both our feet, the most important thing is alignment. What is our alignment like? Is our alignment off? Are we doing things such that the back muscles are undergoing a lot of strain, and that's causing the pain in the back? So the number one problem for back issues is usually a matter of alignment. Of course, if you carried something heavy in the gym that you may not be used to, or you have been having a very poor form or posture when you're carrying this heavy load, then you can get other issues as well. Like, for example, maybe a slip disc, as you heard. It's a very common colloquial layman term that is slip disc. But what exactly is a slip disc? A slip disc is actually basically a condition in which some of the material within the intervertebral disc, which is basically the disc or this structure that is in between the bones, okay, it seeps out and it presses on the nerve outside. All right. As you can see, there are some nerves outside these the discs, And these nerves can sometimes be pinched by this slip disc, or so-called this fluid or this gel-like material that comes out and presses on the nerve. Now, in 80 to 90% of patients who have slip disc, the treatment is usually conservative. Bed rest, analgesia, some form of medications to help to relax the muscles, and physiotherapy can help 90% of patients with slip disc issues, and they are usually okay after 3 or 4 days. Their pain gets better. But the more important question, or the more important concern that these patients should have, is that once you have a slip disc problem, there's a risk of the slip disc happening again, because the primary reason why the slip disc occurred is because your muscles and the back are weak, and your alignment and your posture is poor, especially with the activities you do. So a good physiotherapy program should have education as a very important pillar in that physiotherapy program, in educating patients in what the proper posture it should be when you're carrying heavy loads, what is the kind of exercises you should be doing to actually strengthen the core and the back muscles to prevent injuries in the future. And if these things are taken into consideration moving forward, the risk of a slip disc problem happening in the future will be lesser. Now, I want to show you this picture of an MRI scan, which shows you what the difference between a healthy disc is and an unhealthy disc is. As you can see on the picture on the left-hand side, the discs is actually this slips structures between these squarish structures. The squarish structures are the bones, and this disc is actually the structure that's in between the bones. And you can see in this disc and this disc on the bottom here, it's very dark in color, which means that it is actually very degenerated. It has lost a lot of its fluid, and therefore it is actually it's very hard and is easily injured. All right. Whereas a disc that you see on the top, it's a little bit more healthier because it's got white color in the MRI scan, which means that there's still good water content. Now, the water content in the disc is very important, because what your spine is at the end of the day, your spine is actually like a suspension mechanism. It is something that needs to be taking the weight of your body. So it has to have this disc that actually is bouncy and healthy. And what makes it bouncy is actually the presence of good amount of water content within the disc, because that allows it to be like a bouncy ball, essentially. Now, when you lose water in your disc, it becomes a deflated ball, essentially. And therefore, when it's deflated, it actually causes problems because it becomes more easily injured because it's deflated. And also it causes other issues as well, because now you have stress, that the disc is not being able to take the stress of your body or your weight, and now the weight is transferred to the back muscles, and the muscles are doing more work, and it causes more problems. So it's very important, therefore, muscle strengthening is important to actually help you, to actually prevent you from having future problems, especially if you had a slip disc before. Having good posture is also very important. All right. Now, as I mentioned previously, we all reach our peak bone mass at the age of 35 for both men and women, as you can see on the graph. And so therefore, as I mentioned previously, if you make good habits from the age of 18 to 35 in being healthy, doing more sports or outdoor activities to build up your vitamin D, your calcium levels, then you will have a very high peak bone mass that you can hit and enjoy it at the age of 35. Okay. Now, after the age of 35, you actually lose 1% of your bone mineral density every year. All right. And for women, there's an added insult to this, because when you undergo menopause around the age of 50, you get another deeper decline in your bone quality because of hormonal decline as well. All right. So that can also be that's also the reason why we see osteoporotic fractures more commonly in women, because of the fact that menopause has an added insult to your bone quality. All right. Now, but the most important thing to know is that we can actually prevent this from happening. How do we prevent this from happening? I mean, let's say we missed that boat when we are before the age of 35. That means we have not reached our potential or genetic potential for peak bone mass at the age of 35. We can still do well by preventing the 1% decline yearly by making sure that we do strengthening exercises, making sure that we take our nutritional supplements of vitamin D and calcium, which is important for our bone health. So I always tell my patients that, you see, the most modifiable part of your bone and joints is actually your muscles. I mean, you cannot genetically, choose your parents essentially, because, I mean, you may have maybe genetically, you are limited with your amount of bone health that you may enjoy, your potential, but your muscles, they respond to treatment, they respond to exercise, they respond to strengthening. And so I always tell my patients that the most modifiable structure is your muscle strength. So concentrate on it. I would say that especially in elderly patients, when I say elderly, I'm talking about above the age of 45. If you're a man, I think it's important for women as well. Above the age of 45, you should concentrate mostly on strengthening exercises, because you are also going to be noticing that your muscle strength as you grow older is going to decline as well. So you have to prevent that decline by concentrating on strengthening. Remember, I spoke about the falling blocks, the alignment previously with the Jenga. Now, the reasons why the muscle strengthening is going to save you from becoming this Jenga block that's going to topple is because the muscles are then going to balance it out. It's going to be the additional support to your Jenga block that is going to fall off. And so if you make your muscles strong, you can preserve your bone and joint health for longer. A good habit goes a long way. You don't need the gym. You can even do it at home with body weight resistance exercise. But the most important thing is to do it regularly and consistently, because it is not enough to just maybe spend maybe 1 week, I do it well, but maybe the next 2 weeks, I don't do it well, or I don't do it at all. Then you lose that consistency, and that is the most important thing in a strengthening program. Now you can do it, maybe what the American College of Sports Medicine recommends for patients is a strengthening program, maybe 3 times a week, that maybe you can spend about 10 to 15 minutes just doing some body weight exercises that help to build up strength is sufficient to actually give you that added benefit for your bone and joint health. Okay, so there's this portal basically that is present that basically prescribes exercise for individuals or seniors or even young people who are interested in going through an exercise program. Now, I think it's important to understand that exercise is like medicine for in many ways, and it's something that I think population doesn't seem to still grapple with it, because they seem to think that exercise is only a privilege maybe for people who have time. But I would dare say that exercise is actually one of the most effective medicines for patients with bone and joint problems. And there's this portal, Exercise Medicine Singapore portal. The website is there, and it's a portal that you can use to find certified exercise prescription providers. What is exercise prescription? Exercise prescription is basically it's something like a medicine, and a individual or a doctor who is certified in actually prescribing exercise for you will be able to do this in a safe, enjoyable, and consistent way in which you can actually do exercise that may be beneficial for your bone and joint health. And I'm pleased to announce that we are actually the first private orthopedic clinic in Singapore to be certified as a EMIS certified provider in Singapore. So if you want to look for us, you can certainly look for us. Okay, so as I mentioned, exercise is important. It's something that I would certainly encourage anyone, even if, like in the beginning of my talk, I said, I don't think we should have this approach where, you feel that you're having this joint pain. The next step is I'm going to rest it to make sure to see whether it gets better. I think that is not the right way to go about it. I think we should concentrate on exercise. When I say exercise, I'm saying it very broadly in terms of strength, conditioning, balance exercises, and endurance exercises, because there are many components of exercise. And a specific component is important for specific patients who are intending to actually do the exercise to help them with their musculoskeletal problems. All right. So the more important thing that as an exercise medicine provider that I can actually help patients with is determining the kind of frequency of exercise that you should be doing. What is the intensity that you should be doing? What's the type of exercise you should be doing, and how much time you spend on exercise? Because everyone is different, and we will need to actually prescribe exercise that is specific to you. All right. Now, as I mentioned, healthy aging is more than just good bone and joint health. Okay, so like diet is a very important part of it. Okay, having a healthy social circle, very good emotional support. Okay, also constant moderate physical activity, avoidance of bad habits such as smoking. These are also good for making sure your bone and joint health is optimal. All right. Okay, so as I was talking about nutrition, okay, so I wanted to just show you this picture of calcium and vitamin D supplements, because I see a lot of patients in my clinic who are basically deficient in vitamin D and they don't know they are deficient in vitamin D, because they may be very young patients, but they think that they are young and they may not be deficient because they're healthy. But essentially, when you check your vitamin D levels, you realize that you're deficient. So the minimum amount of vitamin D that is required daily is about 1,200 milligrams per day, and for vitamin D is about 600 international units. Okay, and it has been found in research these days that there is also a vitamin K2 that is actually prescribed with calcium and vitamin D. What this does is that it actually helps to direct the calcium that you're taking into your joints and your bones. Because you see, if you just take calcium, sometimes there's this risk that the calcium can actually go into your arteries and cause other issues like atherosclerotic plaques that can lead to heart disease. So they have found in studies that if you take K2, which is basically a vitamin K2, it helps to direct the calcium and the vitamin D into your bones, which is where we want the vitamin D to be, essentially. Okay. Now, we talk about the appearance of an osteoporotic bone and a normal bone. So osteoporosis basically means that the bone is less dense. And you can see that if you see an osteoporotic bone, it looks like it's got a lot of porous parts inside it, which means that it doesn't have the strength or density that is required. And because it doesn't have the density, it can lead to fractures. So you can see that this is an example of an X-ray of a patient who has an osteoporotic fracture of the hip. And the hip is a very important component of the musculoskeletal system because it's part of the joint that actually supports your weight. And when you have a fracture, you can't walk. Essentially, there'll be pain. And in this day and age, we have the technology to fix these fractures like within a day surgery cases, and the patients can walk almost immediately. Now, the thing about elderly patients, when they have a fracture like this, is the aim is to do the surgery as early as possible. So gone are the days where, we had to wait 1 week for the surgery. And you see, when elderly patients have a fracture like this and they are lying in bed without the ability to walk, they lose muscle mass within the next 2 days. And when you lose muscle mass, it means that even if I fixed your fracture 3 or 4 days later, the problem is that because of the fact that you've lost the muscle mass, you have weakness in walking, and that can be a problem as well because your rehabilitation is going to be very slow. So muscle is so important in the elderly, and it's such an important currency that we shouldn't lose muscle unnecessarily when we can actually treat the fracture early. Now, so next thing is that aging leads to loss of collagen as well. So collagen and calcium hydroxyapatite, which is basically your calcium supplements, are very important, and this is a very important supplement that you can take also to help your bone health. Okay, and I wanted to talk a bit about bone mineral density test, which is something that will encourage patients who are above the age of 50 to go for once yearly, because it helps to improve your, to know what your bone density is like. And if someone has got low bone density, they may be needing to take supplements for this. Okay, I'll go through very quickly with some interesting cases. This is a patient with a 37-year-old lady. As you can see, she's got a deformed ankle and she had a very bad fracture of the ankle. You can see how bad the fracture is, a fracture dislocation, and we fixed her quite nicely, and she was walking about 2 weeks later. All right. And I want to just very quickly talk about shoulder injuries. This is a 16-year-old rugby player who you can see he had an injury by an oncoming player on his left shoulder. He was side-swiped, and he was having a lot of pain, and he couldn't move his shoulder up more than 90 degrees. And you can see on the MRI scan that there's a circle there that shows that there's this tissue that is actually injured, and this tissue is called a labral tissue. It's a very common tissue injury that can happen in patients with dislocation of the shoulder. Unfortunately, he needed surgery because his pain was not getting better, and we did a keyhole surgery to repair the lesion. Okay, this is a little boy. We don't operate on all our patients. So this 8-year-old boy fell down his wrist during football. But you can see we treated this patient conservatively, and his fracture healed just within 2 weeks. You can see how good the bone quality in patients who are 8 years old are, because they can actually heal in such a fast period of time. All right. This is another 40-year-old ship captain who had an offshore injury on his vessel when he fell 12 meters. You can see it's a bad fracture of the humerus, and he had a plate done, and he was able to move his arm, and he went back to Indonesia after that. Okay, another patient, 68 years old, very slightly elderly lady. She had an injury overseas on walking in Kashmir, and she tripped and fell, and she came to see me about 2 weeks later, actually, after an injury, because she was still overseas, and she couldn't walk at all. She was in a lot of pain, and the ankle was very deformed. So we actually fixed her, and I just wanted to show you that, you see, we can even operate on 68-year-old patients with good results. And this patient even had diabetes, but she actually healed very well. And you see, medical problems shouldn't be a reason why we don't operate on patients who need it, because the most important thing at the end of the day is mobility and strength. And if you have a medical problem, it shouldn't be a contraindication to helping you get your mobility back. All right. So this is another patient, 43-year-old man who had basically he's a very fit, active individual. He had a gym injury on his left knee when he just accidentally missed his step. And you can see he came to see me about a month later thinking that it was just a sprain, but we could see that it was a malaligned fracture. So we actually did a realignment surgery. As I mentioned, alignment is so important. We have to realign his bones to get him to function properly. All right. And this is another lady, a man with a hand fracture. And you can see what's happening here is that he's trying to clench his fist, but his little finger, his little finger is actually crisscrossing his ring finger, and that means there's a rotational deformity on the bone, and that would mean that he needs a surgery to correct this rotational deformity so that he can actually function better, because it's his dominant hand. He's right-handed. And this is another very common surgery I do, is an ankle ligament tear, which has not been better with physiotherapy. And you can see where the tear is. There's a very torn ligament at the bottom here. And usually you're not supposed to see the bone like this, because the ligament is actually supposed to be with the bone. And how we do this surgery is through a keyhole procedure. And it's a very quick surgery. It takes about 45 minutes. Basically, we basically get we secure the ligament with a suture, and then we actually basically reattach it back to the bone. And you can see now you don't see the bone anymore because it's been reattached. And patients can actually walk after 2 weeks without any problems. Okay, so I want to just finish up my discussion so that we have some time for questions. Okay, so take-home points. Aging gracefully with a healthy bone and joints possible with current advances in orthopedic care. However, we all need to work with nutrition, strengthening, and good mental health with happy social environments so that we all age gracefully. And attention to posture and alignment and a carefully curated strengthening program can help. And orthopedic surgery will enable effective treatment for conditions that are not amenable to physiotherapy and other conservative treatments. Thank you very much.
Thank you, Doctor. Thank you very much, Doctor. It has been an enriching experience to understand how imperative to ensure a strong foot and ankle at every stage of life with help of suitable footwear modifications. Key takeaway for us is surgeries are not the only option here, but with various physio, footwear, strengthening muscles can prevent and cure. Post-COVID, increase in work from home, the back pain is a common problem, but the way you explained help us to understand on good posture, age-related bone loss, muscle strengthening exercises can prevent that. Healthy aging is more than just good bone and joint health. Thank you, Doctor. I take this opportunity to thank you on behalf of GOPIO and all participants who are captivated by your talk. Let's go on to the next segment, which is a short Q&A sessions. We've got quite a lot of questions. Let me just share my screen. Okay. The first question is, I have a regular leg pain from Anuj and foot pain due to long-standing hours. Is there any food I need to avoid? Over to you, Doctor.
Okay, so I don't think there's any food you need to avoid if you have regular leg pain and feet pain due to long-standing hours. But I believe that, as I mentioned, that if you have regular leg and feet pain, is it only due to your long standing hours, or could it be an alignment issue? And now that is something that you may need to actually assess with a professional who may be able to give you a more objective idea on your alignment. All right. Now, of course, long standing hours is a contributing factor to regular leg and feet pain for sure. But how do we prevent this? I believe that taking regular breaks may be helpful, making sure that you stretch your calf muscles and maybe even other muscles around the knee and the hip will be useful to actually help to prevent these problems. Now, if you have leg pain and feet pain, don't forget that you also need to strengthen your hips as well, because you see your hips are also part of the joint that is actually taking the leg and the feet weight as well. So if you have an issue with your leg and feet, don't forget that you may need to also address your hip as well in terms of strengthening issues. Now, I don't really believe there's any food you need to avoid, but I would certainly encourage, especially if you are not having enough protein in your diet, because if you want to build up muscle to help your strengthening, you may want to take food that may have protein. Okay, so vegan sources of protein. If you're vegetarian, that will be good. If you're not vegetarian, then healthy sources of protein in animal protein is also something that you can take. But I don't believe that there's any food you need to avoid. Yes.
Okay, thank you, doctor. Next question from Swapna. Vitamin K2, is it something that you need to buy separately, or does it come in combination with calcium and vitamin D?
Okay, so most of the supplements in the market that come with vitamin K2 comes with calcium and vitamin D. So usually if you're getting calcium supplements or vitamin D supplements, look for those with vitamin K2 in it.
Okay. So the next question from Martin Stephen. Absolutely brilliant lecture, of course, yes. Does the mecplasty lend itself more to UK than TKA? And has there been issues of pinhole fracture and iconic blood loss, the MACO in your experience?
Okay, so generally speaking, the Marcoplasty can be used for both UKA, which is basically a unilateral knee replacement, and the total knee replacement, which is TKA. So I think what Martin is trying to ask is that in some patients who have arthritis of the knee, sometimes the arthritis of the knee doesn't affect the whole knee. It affects only a certain part of the knee. Now, there is a procedure called unilateral knee arthroplasty, which is what UKA stands for. And we do this procedure for the arthritis that is affecting one part of the knee. And it is true that a Marcoplasty has a huge advantage in doing a UKA compared to doing a TKA. So a Marcoplasty, if let's say a patient has got UKA, I would probably 100% try to use the Marcoplasty for a patient with UKA. Now, in a patient who has total knee replacement from maybe arthritis that is affecting the whole knee, the Marcoplasty is still advantageous, but the advantage is, I would say that it is not will not be like so much advantageous more than the UKA in a sense, but it is still advantageous to do the Marcoplasty with a TKA. Now, I would say that when it comes to pinhole fractures and iatrogenic bone loss with Marcoplasty, I haven't had the experience myself, but certainly it's a risk. Now, the way to do it is if you are going to put in the pinholes for the Marcoplasty, it's basically technical, and I think this is a very technical discussion. I mean, this is a very general discussion, and basically when you want to prevent a pinhole fracture, the more important thing is you need to know how to drill the holes. So if you know how to do it in a safe, proper way, then you probably will not have this complication.
Thank you, doctor.
Yeah.
How do you prevent knee-generated issues? Question from Chandra.
Yeah, so as I mentioned previously, knee degeneration sometimes can be a very genetic thing. It's something that it may just be you may have a genetic predisposition to a misalignment in your knee, maybe because there's a gene that makes it such that in your family or in relatives you tend to have a misalignment. Now, if you have a misalignment and it's something that is detected early, the things that you can do to prevent it from becoming a problem in the future is to do a lot of strengthening, because strengthening will help to reduce that stress that your joints are facing, and it helps to prevent the degenerative problem. Of course, wearing certain shoes that can help to realign your knee in a proper way can be useful, but it'll be good for you to see a surgeon to assess that alignment, because then they can advise you on, you know, what are better shoes or what are the modifications in your shoes that can be made to actually help to prevent the stress on your knees. So that's how you can prevent knee degenerative issues.
Okay, thank you, doctor. The next question is, thanks for organizing the issue session. This is from Vengat. I've been experiencing pain in my tennis elbow for the last few months, all of a sudden. Any permanent cure possible for such pains?
Yes, certainly. So tennis elbow is a very common problem. It doesn't mean that you get tennis elbow from playing tennis, but tennis elbow is basically a colloquial term for what in medical terms is called lateral epicondylitis, which is basically inflammation of the muscles that is attaching to the elbow, where the outside of the elbow, essentially. Now, this problem, usually what will help is physiotherapy and something we call a counter brace. There's a device called a counter brace that you can actually use below your elbow that can help to reduce the pain, and I've got a lot of success from prescribing this to a lot of my patients, okay, in addition to physiotherapy. Now, of course, if physiotherapy doesn't seem to help, or even the counter brace doesn't seem to help, then sometimes what we will recommend is an MRI scan. Now, why I will do an MRI scan is because I want to make sure that there is no bad tear in the tennis elbow, because sometimes if there's a very, very bad tear in the area where the muscle is attached to the bone, I mean, of course, we can always try conservative therapy like a steroid injection, but sometimes the tear is quite bad. Sometimes you may need surgery, but like I said, the first step is usually physiotherapy and using a counter brace, which will help.
Thank you, doctor. Steroid injections for various foot, back pain, and ankle pains being prescribed by various doctors, though it has side effects. When and what condition we need to offer steroid injections?
Okay, so steroid injections, at the end of the day, is an injection that can be thought of as something to relieve pain. So the thing is that it is a very effective treatment for patients with pain. And what I would usually do in my patients is that at the end of the day, steroid injections can be done for some conditions very safely and very effectively. And one of the common conditions that I would say that may help with steroid injections is like frozen shoulder. So if someone has got frozen shoulder, if you have heard of this term, frozen shoulder is basically an inflammation of the capsule of the shoulder joint, and it leads to a lot of stiffness and it leads to a lot of pain. Now, the reason why I think steroid injections are very effective for this condition is because the shoulder movement is so important for our function. Like even, cleaning ourselves after we've used the toilet, we need to use our shoulder to actually move our hand behind sometimes even, or even like, just doing basic activities like eating. It's such an important joint for daily function. So when someone has got a frozen shoulder, I'm actually very, my threshold for actually offering patients a steroid injection is very low, because I think it's so important for function, to just get them to relieve the pain and to actually get some mobility in their shoulder. All right, so that's what I would say that sometimes I tend to give it for that condition. Now, for the other conditions, it is, I would say, something that you can opt for if other medications have not worked, or physiotherapy hasn't worked, and you are in a lot of pain that is affecting your lifestyle, and you want something to relieve you of your pain. Yes, we can certainly do a steroid injection. It is very effective, but I will not give injections more than twice often, because as I mentioned, if you take a lot of injections or more than 2 times the injection, it has the effect of softening the cartilage, softening the tendons, and this can lead to rupture and other side effects which may not be so ideal. Yeah.
Okay. Thank you, doctor. Can bow legs be corrected?
Yes. Okay. Through surgery, yeah.
What are the common foot and ankle problems can be addressed through physio, muscle, and strengthening to avoid surgery? Are there any other non-surgical options?
Yeah, I mean, if you talk about non-surgical options, there are injections. There are also other injections other than steroid injections. There is something called platelet-rich plasma injections that can be used to address some of these conditions. okay, there is also physiotherapy, shockwave therapy, there are heat therapy. These are things that can be done to actually help to address these problems, other than physiotherapy and muscle strengthening. Yeah.
Okay, thank you, doctor. Muscles grow stronger from exercise. They pull harder on bones. Does muscle strengthens bones?
Yes, it does. It does strengthen bones because when your muscles are strong, all right, what that does at the end of the day is that your bone is able to take more weight because the muscle is also supporting it. So when it's taking more weight, it stimulates the bone to take more calcium and become stronger and more dense. This is especially important before the age of 35. That's why it's important to do your activities, your muscle strengthening during the young age before you hit peak bone mass, because that muscle strengthening is going to be allowing you to actually build up more bone mass.
Okay, thank you, doctor. I think there's a generic question from Koshu. Please provide more info on the treatment of B unions. I think, Koshu, if you are online, is there anything specific you want to ask, Koshu, or is... Okay, if not, probably yes, doctor. Sorry, over to you.
Sorry.
Okay, so I'm sorry.
I just wanted to, because you were very quick when you discussed bunions earlier.
Yeah.
I just wanted a little bit more information on that. Thank you.
Yeah. So essentially, the treatment for bunions, generally speaking, will be using something called silicone spacers if we are taking the option of non-surgery. All right. Now, the treatment for bunions, it actually really depends on how bad the bunions are, and a lot of times we do X-rays for patients with bunions to see how severe the bunions are. Now, I also do not believe that the X-rays itself is the only thing that is important in assessing patients for bunions. I think the most important thing to address for patients' bunions is how much the bunion is affecting them. Is it painful? Is it preventing them from wearing shoes? Or the other issue is that is the bunion a deformity that is actually causing the other toes to also become deformed? Because very commonly you have bunions and you also have the second toe that is actually going over the bunion as well. And that is actually a deformity, not just because of the bunion, but also because the second toe is becoming worn out and it's causing a deformity. So, I mean, it is something that needs to be addressed very specifically with thorough investigation before we can actually give you a treatment for bunions. Because when we talk about bunion treatment, not every patient has the same treatment for bunions. It really depends. And so I'll probably want to assess the patient more thoroughly before deciding on the proper treatment for bunions.
Thank you, doctor. I think I have one more person who's been raising hand, Rama Devi. I think she has some difficulty in raising the question. Rama, do you want to explain what's the question you would like to ask here? If you're online, Rama Devi. Rama, are you there? Okay, if not, we'll go with... Let me stop the screen.
I think
There are quite a few people.
Anandakumar has raised his hand.
Yeah, Anand.
Yeah, so it's all right, no problem. Consider the nerves problem. Suppose my wife having some problem for the stiffness and knee pain and walk, very difficult to walk, and the body fully pain. Because last time I treatment at the Alexandra, but still they have some pain, all the things. So can I provide only I saw the video muscles pain and bone density. Yeah, definitely they have some bone density less. So now sometimes the nerves very stiffness. Any help us to do this thing? I meet if you possible. I meet.
I think it may be better for me to see your wife, or you make an appointment, because frankly speaking, it seems to be more complicated. If she's got body pain and knee pain, it seems like there may be some general issues that may be happening. I mean, I think it may be better to have more information.
Yeah, the one they sometimes the nerves all the very stiffness and the muscles very tight.
Yeah, so it may not be an orthopedic problem as well. It may be maybe related to muscle issues or maybe even rheumatological issues. So I think it's not easy to comment from an orthopedic point of view what exactly the issue is or how I can help her. It may be better for her to be assessed more thoroughly.
Yeah, thank you very much, doctor.
Thank you.
I think we have one more question, doctor, from Geeta. Thank you, doctor. I'll follow the information for increasing my protein and vitamin intake. I think that's the only details. So fine. Okay. We can go for one more question if you want. The last question for the day. Will there be any? Okay. Yeah, that probably we can respond later. Any other question, any participants? If not, it's fine. Okay. Thank you. Thanks a lot, doctor.
Thank you.
Thank you. Thanks for the fruitful Q&A session. In the interest of time, I think thanks so much. Thank you very much for your questions, participants. This event wouldn't have been possible without the tireless efforts of the organizing team and several other individuals. And to deliver the vote of thanks, may I invite Mr. Tam Shanmugam, the organizing chair, member of executive committee, to the stage. Tam, the stage is yours.
Yeah, thank you, Anandakumar. Good evening, everyone. First and foremost, I would like to thank our esteemed speaker, Dr. Anand Vella, for taking the time to share his valuable insights on the orthopedic of young and elderly. Thanks, doctor, for your time. So when I approached Dr. Anand, he immediately accepted and said he came up with this topic and said this is something which is critical, and then let's do a talk on this. That's how this entire event came about it. And thank you, doctor. I'm sure this would have benefited the audience today. I would also like to extend my heartfelt thanks to our president, Mr. Hari Krishnan, whose leadership motivates us to organize various useful events and engage the Indian community, including this health talk. Unfortunately, he couldn't make it today due to other conferences he's held up, but he's behind every successful event organized by GOPIO. A special thanks to our first Vice President, Mr. Chandra, who introduced Dr. Anand to me. Thanks, Mr. Chandra. This event wouldn't have been possible without your support and guidance. I'd also like to thank Mr. Padu, who came up with this colorful flyer, which helped to reach the larger audience. His generous support and collaboration have been instrumental in making this event a success. I'd also like to extend my thanks to Mr. Anand, the Secretary of GOPIO Singapore, who was managing the Zoom session today. Thanks, Anand, for your support and help. I'd also like to thank Vasanta for her help to get things together, to find the right people for the right task, including our MC, Mr. Anandakumar, today. A special thanks to all our GOPIO Expo members and other members of GOPIO, whose hard work and dedication behind all our event have ensured that everything runs smoothly. Your commitment and tireless efforts are deeply appreciated. To our audience, thank you for your active participation and engagement, your enthusiasm and involvement, or what make events like this meaningful and impactful. You are so interactive with a lot of questions, useful questions you have asked. So we hope you found the session very useful, enriching for yourself, right? Lastly, I would also like to thank Mr. Muthukumar, who accepted to be the MC of today's event just a few days ago when we reached out to him. This talk was very well coordinated and his contribution has been invaluable. We are truly grateful for your support, Mr. Muthu. In closing, I would also like to say that events like this remind us of the power of coming together to share ideas, learn, and grow. Thank you all once again for being part of this talk. So as someone asked, we would be having this session regularly on a quarterly basis. So please do join us. See you in future gatherings. Have a great evening and week ahead. Thank you. Over to you, Mr. Muthukumar.
Thanks a lot, Tam. Well, all good things must come to an end. And with this, we come to an end of today's medical talk session. As we draw close to the end of this insightful seminar, we express our gratitude to the speaker, Dr. Anand Vellasamy, and to our esteemed audience for your active participations, and GOPIO for making this seminar a vibrant pool of knowledge exchange of common problems in foot, ankle, and back pain. We hope everyone leaves with a greater understanding and new perspectives of the various foot and ankle and back pain problems on how to prevent or avoid with some non-surgical method as well. GOPIO Singapore would continue to conduct similar events, as Tom said, on a regular basis. So please be on the lookout for our next health series event going to happen on September 2024. I thank the organizing committee to have entrusted this opportunity to conduct this session as your MC. Thank you very much for joining our session and see you next month. Signing off, Muthukumar Rajendran. Thank you. Goodbye.
Everyone.
Thank you, Muthu. Thank you.
Thank
Thank
you.
you, Doctor.
Thank you.
Sure.